Did you know that cervical cancer can be prevented? A vaccine is available to protect against the human papillomavirus, or HPV, the most common sexually transmitted infection that can cause cervical cancer and other diseases. Although HPV vaccine is proven to be highly effective in preventing HPV-related diseases, misconceptions still exist about how it works, who should receive it, and whether or not it's safe. On this week's Health Talk, we'll discuss myths about HPV, the HPV vaccine, and the facts you need to know. Stay tuned. Health Talk is up next. Hello, I'm Dr. Christopher Larock, Chief Physician Executive here at Nuvance Health. On this week's Health Talk, we're going to discuss how to prevent cervical cancer. Our guest is Dr. Linus Chuang, Chair of Obstetrics and Gynecology at Nuvance Health and a leading gynecologic oncologist. It's great to have you on the show, Linus.
Thank you. Thank you for having me today.
Many people have heard about HPV, or human papillomavirus, and cervical cancer. Can you talk a little bit about what causes cervical cancer in women?
All women are at risk of developing cervical cancer. And most of the cervical cancer occurs in women after the age of 30 years old. Long-standing infection of human papillomavirus, or HPV virus infection, put women at risk of developing cervical cancer. And the HPV infection can happen in anyone who is sexually active. About 50 to 80% of sexually active people can contract the HPV infection sometime in their life.
Sounds like the virus is very, very common then, and people who are sexually active are at most risk. How would a young person who is otherwise healthy know if they were exposed to HPV?
This is not what one can know, but the risk is very high for sexual relationship to contract the HPV infection. 50 to 80% of men and women can contract the infection despite not having this sexual relationship with a risk population.
Mm-hmm, mm-hmm. I know you're a gynecologist, but you're a physician, of course. Can men get HPV?
Yes, men, in fact, all men and women can get HPV. Latest study showed that actually the incidence of HPV infection in men is rising. What we are seeing is there are more oropharyngeal carcinoma in men, and it's really important for men and women all get HPV vaccination. Having women get HPV vaccination can decrease the risk of cervical cancer, but also can decrease the risk of men getting HPV infection. It will benefit men and women through what is so-called herd immunity.
So let's talk about the vaccine a little bit. It sounds like it's important for everybody, young people and as they age, men and women. This is not just a gynecologic matter, although the topic today is cervical cancer. Can you talk a little bit about the vaccine, when people should get it or be offered it, who it should be offered to, and what are some of the things that should be considered for a patient who's looking at getting the vaccine?
So after 20 to 30 years of research, in 2016, which was about 15 years ago, FDA approved the use of HPV vaccine. What's available here today in the US is a highly effective vaccine called Gardasil. It contains of 9 valents, and it can prevent 90% of cervical cancer. And the recommendation is to get the vaccination to boys and girls before they have their first sexual encounter. The best age is around 9 to 11 years old, but the FDA realized that some may not have the opportunity to get at that age, so it includes for boys and girls up to 26 years old, and recently FDA expanded this indication to men and women up to 45 years old.
So it sounds like it's broadly available, and there's a lot of science that we'll talk about its effectiveness and its safety. But I'm thinking back to 2006, the date that you referenced as when the vaccine Gardasil became available. My own daughter was 8 years old at the time, so we had to consider as parents whether or not this was a vaccine that would be appropriate for her. And there was some controversy at the time, if you remember. Do you recall the controversy?
Yeah, it's a lot of people question if I raise my children appropriately, and they wouldn't be getting HPV infection. But the fact is that HPV infection is not infection that is uncommon. It's passed on through sexual relationships, and about half to 80% of us at some point we get this infection.
Yeah, it sounds like it's something that we're all exposed to just through normal, healthy human activities, and to the extent that we can prevent it with a vaccine, that's terrific, especially given the serious consequences that can be associated with it. So let's talk a little bit about that. There were more safety concerns 15 or so years ago, as you said. What's the track record for the vaccine now in 2021?
It had been really extensively studied and used in the last 15 years, and there had not been any major adverse events reported. The most common side effects are some local tenderness at the injection site, and some young people may feel dizzy after the injection, but we have not seen any major concern. And today, as a matter of fact, the use of HPV vaccination has been increasing in the States, and it's also been shown around the world it's highly effective. So I would ask all parents to consider HPV vaccination for their children at the age of 9 to 11. The earlier the immunity that can develop, it's better than getting it later in life.
Going back to 2006, I remember my wife, who's from England, was paying attention to the data coming out of England, and England took a much broader view of the use of HPV vaccine. A lot of the data on safety and efficacy has come out of England. Can you speak to some of that?
Yeah, it's this actually was in England and Australia, and Australia has been championed as the country that it's able to get many of their children vaccinated. And today, the study both in England and Australia had demonstrated that the cervical cancer incidence had decreased since the vaccinations began in 2006.
So we're seeing the long-term benefits of that. So let's talk a little bit more about cervical cancer. You mentioned in your opening comments that all women are at risk for cervical cancer. And just to be clear, would that include women who no longer have a uterus, who've had a hysterectomy?
That is a very good question. And the current recommendation is that if a woman has had normal pap smear or screening within the last 10 years, and after hysterectomy, she will no longer need screening. However, there was some latest study showing that in some group of patients may still be at risk of developing cancer of the vagina. So I will caution that if there's any symptoms such as bleeding or discomfort, you also see the gynecologist for examination.
Yeah, so your answer really speaks to the complexity that surrounds the use of any medication, certainly vaccines that can be used to prevent cancers. And it sounds like a discussion with a care provider, a physician, or an advanced practitioner would be very important. Would you recommend that that men and women enter into conversations about vaccines for HPV with their clinicians?
Absolutely. I think for men and women, they should think about not only for the children and themselves, although the vaccination is best given before any infection, there's data to show that it is still have some benefit despite one had contracted the infection. The recurrence of the condition and persistent virus, the incidence may be decreased after vaccination despite having had previous infections.
I see. So you spoke in depth about the data coming out of England and Australia. What's the track record of the United States now?
It had been shown the genital infection had been decreased, but on the population study, it had also shown the trend in the younger age group, younger than 26 years old, we have been seeing the decreased number of cervical cancers in this group of women.
I see. So again, very effective, and we've got at least 15 years of data now saying that it's safe.
That's correct.
That's very, very encouraging. It sounds like a true medical miracle of sorts. So turning toward cervical cancer, what can a woman who has a cervix expect, or if she's having a certain symptom that would draw her attention that there might be a problem that needs a gynecologic evaluation?
So in addition to annual examination with your gynecologist, one really should be alerted by any abnormal symptoms such as vaginal bleeding, that's between the menstruations, and having low abdominal pain or back pain, to seek care with your primary care doctor or gynecologist. And the reason is that early detection of any abnormal lesions on the cervix and can have treatments that will result in successful management to cure. And even with early cervical cancer, it is possible to do fertility-sparing surgery, which is removing only the lesions but preserving the uterus to allow the woman to have a possibility of having children in the future.
That sounds really important. So can you please tie together the concept of a pap smear, which most people have heard about, and cervical cancer?
So before we have the vaccination, the detection of cervical cancer relies on examination and smearing of the cervix, look at the cells. Most recently, we also include the HPV testing. So a combination of the cytology through the smear and the virus testing, one can detect all the abnormal lesions at the precancerous level. If that can be done for the higher grade precancerous lesions, they can be treated successfully with just an office procedure.
You know, we've talked a lot about the advances in medicine and the treatments of cancers and how optimistic we are that there will be good stories to tell about cancer treatment. But this is really a story about cancer prevention, which is quite extraordinary if we think about it. So it sounds like getting the HPV vaccine is the best way, in addition to having a healthy relationship with your physician, where you have frequent examinations on a timeline that you identified, for preventing this very dangerous cancer.
May I just add that at Nuvance Health, we are a participant of an international study for a patient who already had high-grade precancerous lesion to receive not what we talked about earlier, the prophylactic vaccination, but a therapeutic vaccination. In the earlier phase trials, it's been shown that it can be effective in eradicating these precancerous lesions through the therapeutic vaccine and preventing redevelopment of the HPV infections. So we urge women to consider, should you have a condition like that, to look out for sites such as Nuvance Health for this trial.
Well, I think everyone can appreciate just how blessed we are to have experts like you who are really advancing healthcare, particularly healthcare for women, here at Nuvance Health. So thank you, Dr. Chuang. Unfortunately, we are out of time. This is a really important topic. Thank you so much for joining us today, and thank you to the audience for watching. Please share your comments and questions with us by emailing us at healthtalk@nuvancehealth.org. We'd love to hear from you. See you next time on Health Talk.
Our fight against coronavirus isn't over. We still have to slow the spread and do our part. Let's wear face masks in public. Stay 6 feet or more from others. Follow state and local guidelines. Wash our hands frequently and stay home when we feel safe. For ourselves, for our loved ones, for our future. Let's move forward together. Learn more at coronavirus.gov.
145 over 92.
180 over 111.
182 over 100. And I had a heart attack and a cardiac arrest, and then a stroke.
Your blood pressure numbers could change your life.
A lot of people don't understand, including myself, I didn't, now I do, the impact of having a stroke.
My memory is shot.
When I woke up, I couldn't speak.
If I would have followed a treatment plan, I would not be in this situation.
It's a tough journey.
Lowering your high blood pressure could save you from a heart attack or stroke. If you've stopped your treatment plan, restart it or talk to your doctor about creating one that works better for you. Start taking the right steps at manageyourbp.org.
It's a new life, but I'm going to make it better. Coming back. Ask your doctor, check your blood pressure.
Type 2 diabetes can have a big impact on your life, but how can it be prevented? Well, the first step is knowing if you have prediabetes, a serious medical condition that puts you at high risk for type 2 diabetes. 1 in 3 American adults has prediabetes, but more than 80% don't know they have it. The good news is, prediabetes can be reversed, and for many people, healthy changes in their daily routine can make a big difference. Take the 1-minute risk test today at doihaveprediabetes.org.
Thanks to the human papillomavirus vaccine and screenings for cervical cancer, one type of cancer that can be prevented or diagnosed early is cervical cancer. On this week's Health Talk, we'll discuss advances in the prevention, early detection, and treatment of cervical cancer. Stay tuned. Health Talk is up next. Hello, I'm Dr. Christopher Larock, Chief Physician Executive here at Nuvance Health. On this week's Health Talk, we're going to discuss advances in the prevention, early detection, and treatment of cervical cancer. Our guest today is Dr. Linus Chuang, Chair of Obstetrics and Gynecology at Nuvance Health and a leading gynecologic oncologist. It's great to have you on the show, Linus. Welcome.
Thank you. Thank you.
So why don't you start by laying out for us what is cervical cancer? What's the cervix in a woman? What does it do? And how does it become diseased with cancer?
Cervix is located at the lowest part of the uterus. This is a part that it's in the vagina where one gives birth. The cervix will be dilated. And it's susceptible to any infection, human papillomavirus infection or HPV infection. And this infection is very common. 50 to 80% of men and women can acquire this infection through sex. To most of our people, this infection will resolve spontaneously. However, about 10% of men and women, persistent infection can lead to cervical cancer. And cervical cancer can be deadly without early detection and treatment, often lead to death. Although the incidence is declining thanks to vaccination, screening, and the effectiveness of the treatment, however, we are continuing to see cervical cancer in our community. And most of these women that have cervical cancer are women that had never gone for screening, never seen a gynecologist. We have a lot of effective methods, vaccination, screening. The problem is that we are not failing in our technology, but we're not able to get a woman to come to their doctors for screening. So cervical cancer, although it's honestly crime, but we're still seeing it, and there are women still dying from it. So it's really important to be aware of a few things. One is get our younger children to be vaccinated. Go to see your doctor on a regular basis. Get it screened. Because early screening, it's 100% successful, nearly 100% successful in preventing further development of cervical cancer. Even if you develop your symptom at the earliest phase, and if you have an early cervical cancer, the treatment is 90% effective, and you will not die from cervical cancer. So again, vaccination, screening can all help us to prevent cervical cancer.
So given the prevalence of HPV in the community, it sounds like even though much of those illnesses are self-limited, there's still so much disease burden that you said a full 10% can go on and cause problems for both men and women. So if there's a preventative technique like a vaccine, that certainly sounds like it would be important for essentially everyone to consider. Is there anyone who shouldn't be getting the vaccine?
I would say that it's really a small minority of patients that's allergic to the compound that's used to deliver the vaccine. As a matter of fact, most people, especially those immunocompromised, such as HIV infection, they really should get the HPV infection because there's an association between the HPV infection and immunocompromised people.
Sure. How long does it take for a patient, to get immunity to HPV after they've received the Gardasol vaccine for human papillomavirus?
So it takes 2 doses for boys and girls younger than 15 years old, but for men and women or boys and girls older than 15 years old, it would take 3 doses to acquire the immunity.
I see, I see. And how long does that immunity last? Do you need to get a booster?
That's a good question. We talk about boosters these days often. The science and research, it's not there to show that we need a booster yet, but research is continuing on this subject. But what is exciting is that we actually shifted from 3 to 2 doses for younger people. There are some studies actually showing that perhaps even 1 dose may be effective. So remember, vaccination is highly effective, and there's a lot of development even to be 1 dose will be effective if it is given at a young age.
Mm-hmm. Well, it sounds great to have a safe, effective, and broadly available vaccine. Well, given that, is it necessary for a woman who's been fully vaccinated with Gardasil to have screening for cervical cancer through a pap smear?
Yes, it is very important because what we have now, it's called 9-valent vaccine. It prevents 90% of the HPV infection that causes cervical cancer, but not 100%. So it's still really important to continue to screen for cervical cancer with your primary care doctor or with your gynecologist. The good news is that there's some suggestion that perhaps because your vaccination, you don't need to go and be screened on an annual basis. You can be screened less frequently. So that's a good news for people who got their vaccinations.
Let's shift gears a little bit. Unfortunately, not all patients receive the vaccine. Not all patients, as you stated earlier, get screening or have access to health care. So unfortunately, cervical cancer is still a big deal in America and around the world. You're a surgeon who specializes in cancers in women, in the female urogenital tract. Can you give a little description of your training, your background, your experience, what types of disease states that you encounter and help women with?
Yeah, I'm a gynecology oncologist, which is a subspecialty of obstetrics and gynecology that focus in the treatment of women with gynecologic cancer. Cervix is one of them. The other common cancer in American women are uterus and ovarian cancer. And I'm involved in the surgical management of cervical cancer. Cervical cancer, if it is detected early, typically stage 1 and 2, can be managed with surgery alone without radiation chemotherapy, and the cure rate can be approaching 90%. For women with more advanced cervical cancer, or for women with early cervical cancer that cannot undergo surgery, they can be considered for chemotherapy and radiation given concurrently.
Let's stay on cervical cancer for a while, although I know you treat the other organs of the female urogenital tract. Beyond surgery or potential surgery, are there any new therapies that are emerging that are interesting or exciting to you about their effectiveness?
Over the past year, the immunotherapy has shown great promise for women that had advanced recurrent metastatic cervical cancer. It used to be treating them with chemotherapy and anti-angiogenic medication, but a study published several months ago from New England Journal of Medicine demonstrated the addition of the immunotherapy, the agent's name is pembrolizumab, could increase the survival significantly. So the current standard of care is the combination of chemotherapy and this immunotherapy drug. And Chris, this drug is also available at our center. Our medical oncologists are expert in delivering this type of therapy to our patients.
So what you're saying is the most cutting-edge, innovative therapies for cervical cancer are available right here at Nuvance Health.
Yes, sir.
Right. That's terrific, and I'm sure that if women need to reach out to you, we'll provide the contact information in the Ask Question section later. Let's move on a little bit. Before we leave cervical cancer, though, women sometimes ask, why wouldn't I just get a hysterectomy and remove the opportunity for me to get cervical cancer or uterine cancer?
Wow, what a revolutionary thinking. Chris, do you mean that if I don't have any problem, just remove it? So yes, I've been asked often this smart question. So in choosing treatments, we have to balance risk and benefit. Yes, Chris, when I see patients with advanced cancer, I often ask, after reproductive age, really don't need the genital organs, but there are risks with doing a surgery. There can be complications from infection, pain, to more serious complication, although it's only 1%, is injury to other organs near the uterus. So we do not recommend today just prophylactically removing the uterus, but in some at-risk population, I know this is a different topic, in women that had genetic mutation that will predispose them to have uterus ovarian cancer. To your point, that is recommended.
Great. Well, I think our audience can see that Nuvance Health and this community is very fortunate to have someone with such expertise, your training, your background, your experience, your research and innovation that you're bringing to our communities. And we're very blessed, and we'll have future health talks involving you as you focus on diseases of the different organs of the female urogenital tract. But do you want to just speak to some of those procedures and disease states more generically?
So first of all, thank you for the opportunity. So the most common gynecologic cancer in the United States is uterus cancer. And why are we having so many uterine cancer? It's really a result of obesity. So it's really critical that we all try to see whether we can go with weight reduction. There are many ways, of course, with the diet and bariatric surgeries for some population. And fortunately, uterus cancer can be treated easily with hysterectomy most of the time, and it can be successful. The second more common cancer, which is more difficult, is the ovarian cancer. Although it's not common, but often presented with advanced stage. And at Nuvance Health, and along with other experts in gynecology and oncology, we provide advanced surgery. And in some of those patients, we also deliver heated intraperitoneal chemotherapy, which is this cutting-edge treatments that we can provide here. Of course, chemotherapy are very important in these patients.
Dr. Chuang, we're very fortunate to have you at Nuvance Health, and we're very fortunate to have had some of your precious time and your deep insights shared with us on Health Talks. But unfortunately, that's all the time we have for today. So thank you, Dr. Chuang, for joining us, and thank you to the audience for watching. Please share your comments and questions with us by emailing us at healthtalk@nuvancehealth.org. We'd really love to hear from you. See you next time on Health Talk.
Our fight against coronavirus isn't over. We still have to slow the spread and do our part. Let's wear face masks in public. Stay 6 feet or more from others. Follow state and local guidelines. Wash our hands frequently and stay home when we feel safe. For ourselves, for our loved ones, for our future. Let's move forward together. Learn more at coronavirus.gov.